Hello and welcome to this very special conversation. Joining me today is Dr. R.S. Sharma, Chief of National Health Authority and Cowin, to talk about the digitization of the healthcare space, the year gone by, and importantly, the big digital innovations India's healthcare sector is poised for in the year ahead. Thank you very much, Dr. Sharma, for speaking to us and joining us here on Mirror Now. Let me start by asking you about the pandemic and the consequences of the pandemic, because one of the biggest consequences has been the adoption of technology in the healthcare space and how rapidly it has happened. This is possibly one of the most important shifts that we have seen happen this fast.
I think it's a very important question, and of course, it's not customary or it's not politically or otherwise correct to talk about any benefits of the pandemic. Pandemic has been a complete disaster, and for the world, for our country also. So therefore, all the so-called growth in the digital technologies which the pandemic has brought about really is not very significant in that sense of the term from the cost-benefit point of view. However, one must admit that during the last 1 year or more the adoption of digital technologies has really accelerated considerably. And the reasons for that are everyone to see, because we were not allowed to come out, and therefore we were communicating either through video calls or through our normal calls. And then, of course, we were getting all our provisions through online purchases, and also we were paying also through the online, the digital payment systems. So I think we were in a way forced to adopt digital. We also, today we are talking on this digital platform to each other. I think about 2 years back, you would have come down to my office, or I would have gone to your office, and we would have talked over a cup of tea. So that's basically, now it has all changed, and we have all become quite comfortable in communicating and interacting on digital platforms. And we are also realizing that it has a lot of value in the sense that I don't have to travel, the time to travel is saved, the cost of travel is saved. So digital is certainly cost effective. Now, specifically in the medical, in the health space, a lot of things have happened. One is that, we were consulting our doctors through WhatsApp videos, through WhatsApp audios, and, buying medicines online using WhatsApp or using other digital platforms. So similarly, on the video calls also, we were having a lot of video consultations. So telemedicines have really seen a spurt in this area. Digital delivery of vaccine, delivery of medicines has also been one of the things which we have witnessed. And of course, payments is another part. So I think overall, there has been an acceleration in the adoption of digital technologies in this pandemic. And if this is the only probable benefit, if I may call that, out of this pandemic. Otherwise, it has been certainly a very bad year for all of us.
Well, that's right. Now, the Cowin platform itself has seen a lot of transitions over the past 2 years, ever since the pandemic hit. And a lot more is still in the works in terms of expanding the scope of the platform to other areas as well. Can you shed some light on this? What does the future of the Cowin platform really look like at this point?
When we have the vaccine, it is important that the vaccine delivery will delivery in a country like ours, in a country which is so varied, so diverse, so large. This will require a digital, platform or digital backbone to ensure a systematic, transparent, and absolutely, clear kind of delivery of the vaccination programs in this country. Our Prime Minister was absolutely, he guided us, and he told us that let us develop a platform which is of international standards and which is flawless in terms of running. Of course, we were at that time not aware of the scale. While we were aware of the numbers, but we did not know that the platform will scale up so fast, so soon. we struck 1 billion in a matter of 9 months. No platform in the world has sort of grown to 1 billion customers in a matter of less than a year. So I think Cowin platform to that extent has been quite instrumental in ensuring a transparent and there's no asymmetry of information in the sense that I also have the visibility as to where which medicine is being delivered, which vaccine is being delivered. You also have the same, it's a single source of truth in some sense. That has actually helped very much. Imagine, we saw a point in time in April and May of 2021 when the pandemic really, the second wave hit us very hard. And at that time, there was a huge clamor for oxygen cylinders and remdesivir, drugs, medicines. And everybody was running helter-skelter and, searching for the WhatsApp groups for searching as to where I can get oxygen cylinder, where I can get a seat in the hospital and stuff like that. Now, such kind of chaos would have prevailed had we not had a very robust digital platform in vaccination space also. So I think that has been a great help to us. And now that we have tasted success in some sense, now we know that we have created a very robust, a very good digital platform. We want to expand it and extend it to multiple other areas. For example, the immunization program, universal immunization program, which we have for our children in this country, that program can actually ride on this digital platform. And the beauty of that will be like the Cowin's beauty is that we are connecting with 100 plus partners. So it's not a software. It's not a application. It's a platform where everybody is connected through well-defined APIs. So it is interoperable. It is frugal. It operates a single source of truth. So whether you kind of log into your dashboard through Allocation or through Paytm app, you see the same truth. You see the same truth of your vaccination history or your family member's vaccination history. So therefore, such kind of philosophy is being extended now under our Prime Minister's guidance to go to the universal immunization area, to blood donation, camps, etc. And maybe, to organ donation also tomorrow. I mean, what we are saying is wherever you have individuals who want to book appointments, who want to go and donate blood, etc. Whenever you have blood donation camps planned, wherever you have requirements on the blood. So what I'm saying is that similar analogies, the whole process is quite analogous to vaccine process. Now, wherever you have such analogies, we will be able to replicate the Cowin platform to those areas also.
Well, absolutely, Dr. Sharma. So clearly there's no doubt of the huge potential here, but we're talking about expanding it to, like you pointed out, areas such as organ donation, etc. The question here is, how is the misuse aspect going to be curbed? Because even if we look right now, in the current context, there are reports about people using different numbers and different IDs to take the booster doses, for example. So things like that, how will those issues be looked at?
There is always a balance between the convenience and the rigor, so to say. So for example, if we wanted to ensure complete deduplication, to ensure that one individual is not able to take any advantage of this platform, we could have insisted on one kind of identity, like Aadhaar, for example. But we did not want to do that because that would have been restrictive on the people. So we wanted to say that, all right, any identity, and we prescribed 9 of them, you could come with any identity. So what is happening is that people are coming with, identity. First time they came with passport, second time they came with Aadhaar, and there's no way to figure out that this passport and Aadhaar holders are the one and the same person. So that way, those kinds of things are happening. But they are few and far between, number one. And number two, we have provided, suppose you wanted to go abroad and at that point in time, you had just linked your Aadhaar number or your driving license number to your vaccination. But now you want to link your passport. So we have provided that facility. So the platform has continued to emerge looking at the requirements of the people. With regard to the, some people hiding the facts and then, trying to take a booster dose. I'm not aware of such examples, but if the people are doing, it's actually misuse and a fraud, and actually something which is not allowed by law, because we still have these medicines are not available in the open market. We still have emergency use authorization, and emergency use authorizations have certain rules of the game. And if you are violating those rules of the game, it is not good. So that part is really a minor part, but those things have been checked to the extent possible. But we have not insisted on a particular type of identity or a particular type of thing. We have said you just use your mobile number and OTP and you are good to go. So that way, the ease of access, the inclusion, these things are also extremely important. As I said in the beginning, that in a country like ours, you can't have a system. Everybody should not use the same system. So we should allow everybody, whosoever, whatever language. For example, we now have it in 18 or 19 languages, that platform. So those things are already there, and we have continued to work towards ensuring, inclusivity of people. People are not denied the vaccination just because they do not possess a particular device, or they are not, comfortable with a particular technology. That should not become a barrier to their access into the vaccination program, because that's a program for all the people of our country, not really those who are digitally literate alone.
Right, now that actually brings us to the other important issue, which is privacy of data. The more we get onto digital platforms, digitized data, these concerns become more and more prominent. And especially here, we are talking about health data, which in any case is extremely personal. So for digital migration to get to the next level, ensuring this would be most critical, wouldn't it?
You are absolutely right that, we have to balance between the privacy and purpose. That's number one. Number two, it is wrong to think that if you ensure privacy, then the functionality can be reduced, or functionality shall be reduced. People think that, oh, you can't use it this way, you can't use it that way because of privacy, and therefore you can't do anything. That's not the way. Actually, there are concepts like privacy enhancing technologies. There are concepts like privacy by design, and there are concepts that privacy is not a zero-sum game, which means that privacy can be preserved while not compromising the functionality or not compromising the purpose for which the whole system is made. And privacy can be built in design. Imagine, Aadhaar was built in the year 2009-10. And there at that time there was not such a privacy was not such a common or a very important word, so to say. People were not so much conscious of this particular aspect, but we in that year itself, we actually built privacy by design into Aadhaar. And that is why in the year 2018 the Honorable Supreme Court could deliver that judgment saying that Aadhaar does not violate privacy. Of course, those people who are the petitioners and those, they don't really highlight that aspect. But the fact of the matter is that Supreme Court analyzed the allegations of Aadhaar creating surveillance structure, creating privacy problems and other kinds of problems, and each of these was negated by the Honorable Supreme Court. So that could happen only because we had built privacy by design. Similarly, all the softwares which we are building, whether it is UPI or whether it is Cowin platform or whether it is now Ayushman Bharat Digital Mission, we are basing it on the basis of privacy by design, number one. The second principle is that the data owner is the master of his or her own data. So unless we have his or her consent, that data cannot be shared. This is another very important principle. And these two principles, which is basically consent, and if its data is used, there should be a notice to the person concerned. All these things are built into the Cowin design. All these things are being built into the Ayushman Bharat Digital Mission design. So I do appreciate that privacy is a fundamental right, but at the same time, I can assure you that that fundamental right is being very, very vigorously preserved in these domains.
All right, Dr. Sharma, now given the amount of conversation around cryptocurrencies, I can't help but ask you here not about cryptos, but about the blockchain technology and how can it help give that additional fillip to this entire digitization process and innovations that we are seeing in the healthcare space. Your views on that?
Certainly, I will not be able to say anything about the cryptocurrency because that's not my domain. But what I can say is that in my earlier position as chairman of Telecom Regulatory Authority of India, I had actually used blockchain for DND, the do not disturb kind of spam calls or spam SMSs, very effectively. Sorry, very effectively. So I am convinced that these distributed ledger technologies, which is the blockchain, they do offer a very positive and powerful way of data, keeping the data safe, keeping the basically a very non-repudiable transaction systems and multi-party digital sort of contracts, etc. I think it's a wonderful tool which must be leveraged, and I'm sure health also will be one of the beneficiaries of that technology. We must understand that technologies may be made for one particular purpose at the time of their invention, but thereafter they can be repurposed and used for multiple applications. And blockchain is certainly a very general purpose technology which can be used in any transaction heavy kind of environment where multi-parties are responsible for these transactions, and these transactions are to be kept safe as also non-repudiable.
All right, let's now also talk about the Ayushman Bharat digital mission scheme. It's a very ambitious scheme to achieve universal health coverage. What can you tell us about how this is really going to pan out, the implementation strategy that's there at this point?
Let me just say a little bit about PMJY also. So bottom 40% are being covered, which actually amounts to 54 crore individuals, 10.74 crore families. So that's actually provides an insurance cover or assurance cover of 5 lakh rupees per family per year. So that for inpatient, for hospitalization expenses, so that the person does not have to spend out of pocket money. We must all realize that poor people, when they have a episode of some kind of problem or hospitalization, some accident or whatever, they actually get into the web of poverty once again. So I think it's very important that we protect them from that kind of catastrophe. So that's one part which is doing, and we just celebrated about 3 crore hospitalizations this year itself, sometime back. So I think it's very important. Now, the second part is the Ayushman Bharat Digital Mission, which the Honorable Prime Minister launched on 27th of September this year. This mission seeks to leverage technology for delivery of health services which are ubiquitous, which are affordable, and which are quality health services. So these are, and we use technology. Technology makes these services ubiquitous and affordable, and also quality. So that's the game, that's the plan, that's the way we are proceeding. And we have already built during the pilot phase of this scheme in 6 union territories certain building blocks of this scheme, and those building blocks are fairly working. These are the personal health record applications. These are the consent management systems. As I said, consent is very important in the health space or any space for that matter. And we have built the hospitals registry. We have built the professionals registry. So I think all the pieces of this whole thing are already in place. We already have built a robust digital public goods set of digital public goods in the last decade or so. And these are Aadhaar, for example. These are the electronic consent artifact. We have built the digital locker. We have built the electronic signature artifact. So and we have built electronic KYC, electronic authentication. So I think all these tools and electronic payment systems. all these tools are going to be horizontally used by all the health services. So, for example, if I have a teleconsultation with a doctor, the doctor can digitally prescribe the prescription for me. I can digitally pay the doctors. I can then digitally get the medicines. And so, therefore, whole thing is entire end-to-end digital. And great thing is that India has now 1.18 billion telephone connections, 800 million mobile connections, 600 million, smartphones. We have the cheapest data rate in the world. We are consuming the highest amount of data, 12 GB per person per month. So I think we already have a great connectivity infrastructure in place, and that actually makes it possible for India to put together such an ambitious and audacious.
Well, that's right, Dr. Sharma. Let me ask you this then. With the advances that we are making in this space, if you can paint us a picture, how do you see the Indian healthcare system really evolving over the next 5 years?
I think India has leapfrogged in many areas. And I think one of the most critical areas is health sector, education being the other one. I feel that with the digital goods which India has got, with the connectivity technologies which India has got, and of course the kind of investment which India is now making in the health space. So, for example, Ayushman Bharat has got 4 streams in some sense. One is Ayushman Bharat Wellness Center, so which is basically we are making a large number of primary healthcare centers and wellness centers. So that is one part. Then India has got Ayushman Bharat PMJY, which means providing health cover to the poorer people. Then, of course, we have the digital, National Health Mission (NHM), which is there, which also funds, equipments and other things. And recently announced program by the Honorable Prime Minister of the digital creation of digital infrastructure throughout the country is another very important program where we are increasing the health investment. And lastly, the Ayushman Bharat Digital Mission, which again is the one which is going to leverage technology. So I think the vision of our Prime Minister, where he wants to see every Indian to be happy and healthy, especially healthy, is very important. And I think we should all try and come together, because ultimately, let's also understand, Ayushman Bharat Digital Mission will not be materializing in a day, but if everybody, all these stakeholders come together and work on that, I think we can leapfrog in these technologies, which we have already leapfrogged. So I see a great, stride being made into the health space, and with all the 4 sort of pillars of interventions, which the Honorable Prime Minister has announced, these Ayushman Bharat pillars, they are going to certainly transform the healthcare space in this country.
And of course, the budget is round the corner now coming up. Last year, we saw the allocation towards the health sector increasing significantly. Perhaps more even needs to be done even now. But what is your own perspective in terms of budgetary allocation for the healthcare space?
I will not be able to quantify the money, because ultimately it's the prerogative of the parliament which to allocate, budgets to various departments and the government, and they will take that call. But what I can say is that a number of innovations are happening at a breakneck speed in this country, especially in the health space. And I've been looking at many diagnostic innovations happening, which are very cost effective, very frugal, and artificial intelligence and machine learning, these technologies are being used, and of course on the cloud. So I think that space is going to see a huge amount of innovations. So I see innovation will also bring about affordability, improve the affordability of healthcare systems. So that's something which I see in a very positive manner. With regard to the budgets, etc., probably I'll not be able to answer that question, because I don't really have the data with me as of now.
And my last question to you, Dr. Sharma, is your view in what is going to be that biggest change in the healthcare space as we exit 2021 and enter 2022?
I can only say, there are 2 types of events. One event is the one where you have no control whatsoever. So there are external events on which I have no control, and I will not be able to make any prognosis or any kind of, forecast on those things. That's one part. Only thing is that I would see in the health space the schemes which which I am in charge of in the National Health Authority, which is the Ayushman Bharat PMJY and Ayushman Bharat Digital Mission, and also the Cowin, for example. All these are going to play a very significant role, and I would like, I don't know how it will sort of pan out or how it will happen, but I would like a whole sort of ecosystem being built around the digital mission, because I think, Aadhaar has been transformational, you know that. UPI has been transformational, you know that. Similarly, I would like that Ayushman Bharat digital mission also becomes a transformational intervention into the health space.
All right, Dr. Sharma, thank you so much for speaking to us. An absolute pleasure. Thanks for watching.